So when we say infections in gynecology, remember that I don't think that in preparing for this exam, I have to teach you everything. Like, if I do that, it's like I'm repeating medicals. Okay, so we need to really strategize. If you see this, what will you think about? If you see this, what will you think about? You get that predisposition.
Yes, yes.
Good. So we are going to talk about infections in gynecology. You know, the Obs and Gyne discipline deals with what? Women, right? But when we say gynecology, that gynecology deals with mostly non-pregnant women, and then obstetrics deals with pregnant women, isn't it? When I say infections in gynecology, I mean, say this. Just like you can divide the urinary tract into an upper urinary tract and then a lower urinary tract, you can also divide the genital urinary tract. So I think I should begin from there, okay? The genital tract, the female genital tract. So we've come back to basic anatomy, but we will not talk so much about it. We're just talking about it in relation to infections in pregnancy. So the female genital tract can be divided into an upper genital tract and then a lower genital tract. I'm not sure we can finish this entire thing because it's very broad. So I'll just give you an overview. Then, God willing, tomorrow we will continue because I'm very sure some of you are tired. Is that okay?
Yes, sir.
Okay. So the female genital tract can be divided into an upper genital tract and then a lower genital tract. And all these, there can be infections in all these areas, right? So you can have infections of the female genital tract, the lower genital tract, and then the upper genital tract. Let's go to the internet and go and look at the genital tract of females and how they are divided. See now?
Yes, please.
So let's begin with this picture. Yes. Let me go to the images. So let's begin with this picture. Okay, so as you can see, working our way from down up, okay? To trace, we have the vulva. So this is the vulva. The vulva is what you see externally. Let's begin from there before we come to this. So vulva. Okay, so I think we can use this. No, this is too small. Let me look. Yes. So what you see externally, okay, is the vulva. Are you seeing? So this is the pelvis. Sorry, the pubic region where you have the pubic hair. Can you see that?
Yes.
And then this is the vulva. So what you can see externally in the perineum of the female is the vulva. Now the vulva has two lips. Okay, you know that labia means what? Lips, isn't it?
Yes, sir.
It means lips. Okay, so we have the bigger lip. So because it is a bigger lip, it is a major one. Okay, so that's what? Labia majus for one. If you are talking of the two, then we have labia or labia majora, meaning the bigger lips, isn't it? So please take note of that. Okay, labia majora, a big lip. Then if you flip the big lip, apart, then you come to the small lip, like this one, isn't it? Hello?
Yes, sir.
Yes. So that is the the smaller lip. So again, it will be called labia minus for 1. But if you are calling the 2, then it will be what? Labia minora. So what you see externally for the genital tract, in the perineum, is the vulva. Okay, and then the opening. You see, when you part, look at your mouth. When you part your mouth, even before you get into the oral cavity, okay, the space between your teeth and your lips. Are you following me? When you clench your teeth, when I say show me your teeth, and then you clench your jaw, and you show me your teeth, you see that the space which is in between your teeth and then your lip, it is called the vestibule. Are you following? So this is the lip. You can imagine this is the lip. So even before you enter the vagina, the space here in between the vagina in at the back and then the lips is called the vestibule. Are you following me?
Yes, sir.
So in the vestibule, we have on top we have the urethral opening, and then at the down we have the vaginal opening. But we are talking about the genital tract, so we are focusing on the vaginal opening, isn't it?
Yes, sir.
Now, if you are asked what is the, so you let me continue. So when the labia minora meets anteriorly, it forms the clitoris, isn't it?
Yes, sir.
Okay, very good. Clitoris, very good. Now, if there are no questions, if you are asked what is the male equivalent of the labia majora, what should you say? Now I'm sending you to embryology, clinical embryologist. I will not tell you everything embryology of the female genital tract. If it's necessary, I'll tell you. But I'm just hitting on relevant questions. If you are asked what is the male equivalent of the labia majora, all of you have brothers, or you people
Yes.
you let me put it this way. All of you have seen the male genital organ before. The external genitalia, right? Even if you've not seen it physically, you've seen it in books. Isn't it? Please, you are doctors, so stop this apalapa thing.
Yes, Doc.
I don't even know what you've been doing. My job here is to teach. So I'm asking, if you are asked, of course, this is the anal opening. So the female has 3 openings, right? The urethral opening, the vaginal opening, and the anal opening. So I'm asking, if you are asked, what is the male equivalent of the labia majora? What do you think the answer is? You think about it. What do you think the answer is? It's a scrotum.
Yes, sir.
The scrotum. Because Nasma, why are you laughing plenty like that?
Doc, I'm not laughing.
Yo, it is a scrotum. The male equivalent of the labia, because you see, it looks as though this is your scrotum, which has been opening. Sorry, been opening, because the labia majora is fused. You get it? So when you're asked,
yes,
the male equivalent of the labia majora is A. The answer is what? Scrotum. It means once I have said it, it can appear in the mock, isn't it?
Yes, sir.
Yo.
Yeah.
So the male equivalent, so you are saying male and then female. So female has the labia majora. Remember I said that the singular is majus, but the plural is what? Majora. The equivalent here is a scrotum. Labia minora. The equivalent here is the penile skin. Then we have the clitoris. The equivalent here is the penis. We have the ovaries. The equivalent here is the testicles. The testes. Is that okay?
Yes.
So we are back to the external genital, genitalia, right? Now I want us to look at one gland. There's a gland here. When we see Bartholin's abscess, there's a gland here called Bartholin's gland. Okay, that is what can form an abscess. Okay.
Yes, Doc.
Hello. Yes. So let's look at that. Let's look for the Bartholin's gland. So as you can see the vestibule I was talking about, right?
Yes.
So this is the Bartholin's gland, which can what? Become a Bartholin's cyst when it becomes filled with fluid, and if it becomes infected, you form the Bartholin's abscess. Said the Bartholin's glands. Now you can see the Bartholin's gland for yourself. Its male counterpart is called the bulbourethral gland or the Cowper's gland. And the female has paraurethral or Skin's glands. And that is what is the prostate gland. Are we good?
Yes, please.
Please add this to the list of knowledge you know. Louisa, I can clean. Louisa.
Yes, Doc. Yes, Doc.
I can clean. Okay.
Yes, Doc. So,
you know that the females have the round ligament. The round ligament is the one that connects. Let me just tell you. So the females have round ligaments. If it is important, I'll tell you later. Its male counterpart is the gubernaculum. So for now, gubernaculum testis. So for now, just know this. If it becomes very important to tell you the rest, I will. But now know this. Can I move on?
Yes, Doc.
Okay, thank you. So how did we get here? We got here because we wanted to know what the vulva was, isn't it? So we've seen the vulva. Then this is the vagina, isn't it? So we are going to work our way up. If you check it very well, this is the labia majora, the bigger lip, and then inside had the smaller lip. Did you see that? And we see that in between the opening of the labia, the vagina and the lips, we have the vestibule, just like in your mouth. Okay. So now we are going through the vagina. So you see that from the vulva, you move to the vagina. So the vagina, this is the vagina. I'm just tracing it so that you have time to appreciate it. Okay, and then this is the uterus. Okay, and then the uterus has a neck called the cervix. You know, cervical means what? Neck, right?
Yes.
Isn't it? Good. So, what is the whole point of this? I'm trying to tell you that the division, okay, the division of the female genital tract into an upper female genital tract and a lower female genital tract occurs at the level of the cervix. Do you see that? So
Yes.
when you are asked what the female genital tract, the lower female genital tract is made up of, you have the cervix, the vagina. Then they are what? Externally bounded by what? The vulva, isn't it? Then the upper
Yes.
female genital tract would include the uterus, the fallopian tubes, and then the ovaries, isn't it?
Yes, please.
Louise, are you here? So that was my whole point. Division of the female genital tract. I hope I'm recording this thing.
Yes, Doc.
If I were not recording there, I wouldn't have had time to go through everything I did, though. Because already I'm getting tired. I think we are getting to 4 hours. So the lower genital tract, we have the vagina, or if we want to work our way from down to up, the first thing we mention is what? The vulva, isn't it?
Yes, Doc.
Then the vagina, and then the cervix, then the upper genital tract. We want to work our way. It begins with the uterus and its endometrium, isn't it? The uterus, the fallopian tube, and then the ovaries. Have I communicated well?
Yes, please.
Yes, sir.
So when we say lower genital tract infections, what do we mean? It means that if we pick can have what? Infections of the vulva. What else? Infections of the vagina, isn't it?
Yes, Doc.
Vaginal infections. Okay, so vaginal infections. And then infections of the cervix. And that's what? Cervicitis, isn't it?
Yes.
Sometimes the infections of the vulva and then the vagina sometimes are combined into an entity called vulvovaginitis. So one can say that the infections of the lower genital tract can be grouped into vulvovaginitis and then cervicitis. But please just note them this way: that you have infections of the vulva, infections of the vagina, and infections of the cervix, right? Then you come to the upper genital. All of them can be grouped into one umbrella: pelvic inflammatory disease, PID. So PID is an upper genital tract infection. Pelvic inflammatory. Are we good?
Yes, Doc.
Louise, are you okay?
Yes, Doc.
So let me begin with the upper genital tract infection. We said just an overview. We are not coming to discuss PID, or else today we are not closing. I have to meet another group. Upper genital tract. We are saying the umbrella is what? Pelvic inflammatory disease. So pelvic inflammatory disease, in a simplified or layman's term, is actually an ascending infection. It means that it came from what? The vagina. It's an ascending infection, and the organisms are usually polymicrobial. But there are two implicated organisms, but usually it's polymicrobial. Ascending infection of the upper female genital tract. Upper female genital tract. So it means it is a spectrum, right? So if it affects the uterus is part of the upper female genital tract, right?
Yes, doc.
So what is the name of the PID that affects the uterus? Who can tell me the name? Akosia, do you have any idea? Louisa? Nasuma, do you have any idea? It affects the endometrium, so that is what is called endometritis. Okay.
Yes.
Whenever you hear that someone has endometritis, it means he has a PID, but it has affected what? The endometrium. And we said that the fallopian tube is there, so this is for the uterus. Okay.
Yes, sir.
So what is the PID? What PIDs can affect the fallopian tube? How would you call that? You call that what? Salpingitis, isn't it?
Yeah.
And salpingitis is the most common form of PID. What did I say?
Salpingitis is the most common
PID. So that's for the what? The uterine tubes or the fallopian tubes. Then the ovaries can also be affected, isn't it?
Yes.
Then we have oophorytis. Oophorytis. The ovaries have also been affected. And sometimes you can have an abscess, because you know that the fallopian tube is very close to the ovary, isn't it? So you can have an abscess which has what involved the ovary and then the fallopian tube. What's the name of that abscess? Tubo-ovarian abscess. Tubo-ovarian abscess. Then, as you know, the fallopian tube, although it is closely related to the ovaries, its opening is related to the what? The peritoneal cavity. Do you know that?
Yes, sir.
Did you know that, Louisa? That the fallopian tubes open into the peritoneal cavity. That is why sometimes you can have an abdominal pregnancy.
Yes, sir.
Yes. So it can cause what? Peritonitis. So peritonitis can also come from a PID. Okay. So you can have a pelvic peritonitis when the ascending infection climbs out of the fallopian tube, and then it's now involving the pelvic peritoneum. Then that's what? A peritonitis. Are you following me?
Yes, sir.
Then sometimes you can have a complication such that the ascending peritonitis now affects the superior parts of the peritoneum, notably where the liver is. Okay, so you know that this is where the fallopian, the uterus and everything is. So the peritoneum here has been affected. Okay, that is the PID with ascending peritonitis. But I can have the peritonitis also affecting this part. So that this is where the liver is. It's a complication of PID. You can tell me the name.
Yes, sir.
You can tell me the name.
Fitzhugh-Curtis syndrome.
Fitzhugh-Curtis syndrome. That is the name. So this is the spectrum. Okay, what's the other name for Fitz-Hugh-Curtis syndrome?
Hepatitis.
Excellent. Fitz-Hugh-Curtis syndrome. So please, if you've not heard it before, this is your chance. You've heard it before. Anytime you have a patient with PID and then the patient has a right upper quadrant pain, I think that is PID, but there's a right upper quadrant pain, you should suspect Fitz-Hugh-Curtis syndrome, sometimes called perihepatitis. So you see how we've worked our way up. First, endometritis, salpingitis, ovaritis can also give you tubal and ovarian abscess, pelvic peritonitis, and if it involves the peritoneum in the right upper quadrant, you have Fitz-Hugh-Curtis syndrome. Are we good?
Yes, sir.
So can I clear my board?
Yes.
Okay, now let's come to the lower genital tract.
Yes, sir.
When we come to the lower genital tract, we start with the vulva. What infections can happen in the vulva? Yes, give me one. We've been mentioning it all along. Yes. What vulval infection have you been mentioning all along?
Vulvitis.
It's Bartholin's abscess. In the vulva, isn't it? The Bartholin's gland is in the vulva. So Bartholin's abscess. And sometimes you can have some of these STIs, like genital herpes, okay? Right?
Yes, sir.
And then genital warts, you find them on the vulva. Let us go and show, although it is not really that we are doctors, we need to see to be able to appreciate. So let's look at genital warts. Oh, yeah. I want an obvious one. Sorry, it looks some way, but you go need Jimmy there. Mabo in women. Okay, so I think I don't know if this one is very obvious. So let's just use it. So you can see that this is the vulva, right? Can you see this is the vulva? Can you see that? This is the labia majora and then the vaginal opening. And then you can see these warts here. That's genital warts, isn't it?
Yes, sir.
All right. Okay. So Bartholin's abscess. Bartholin's gland abscess. Always will be showing us very funny pictures. We need a hand. This is a very typical. So assuming you were shown this picture, okay, you know that this is a straight. If you're unmanned OSCE station, they brought this picture to you. You can go and make some diagnosis. So you know that this is a Bartholin's abscess, isn't it?
Yes, sir.
How do you know? Because of the position. So you saw that the Bartholin's glands were here at the 7 o'clock position. When I say 7 o'clock position, you understand?
Yes.
And then the 5 o'clock position, isn't it? So this one here, straight away, the diagnosis would be a right Bartholin's abscess. And you see it's on the vulva. Okay, that is my whole point. Is that okay?
Yes.
Yes, sir.
Okay. So these are the infections we'll focus on when it comes to the vulva: Bartholin's abscess, genital herpes, and then genital wart. Then you have the vaginitis. What is the most common vaginitis females complain about? Yes. Hey, Monka. So candida, right? It's candida. Candidiasis. Then other vaginitis. Please, this topic you should master it. Okay. This is the first gynae topic we are doing, so I want you to master it and then get abreast with it. You'll be very fine. You'll be very big. I'm telling you. Vaginal candidiasis. Then you have bacterial vaginosis. Bacterial vaginosis. You also have trichomoniasis. Trichomoniasis. These three are what we focus on. Then we'll come to cervicitis. The two cervicitis I want us to take note of is Neisseria gonorrhea. Have gonorrhea. And then chlamydia infection. So when we talk of infections of the female genital tract, working our way down to up, we start with the vulva. We have the Bartholin's abscess, genital herpes, genital warts. Come to the vaginitis, you have vaginal candidiasis, bacterial vaginosis. You should be able to, a 15-year-old female presents with a greenish offensive discharge associated with vaginal itch. What is the most likely diagnosis? You should be able to say that it is trichomoniasis and not vaginal candidiasis or bacterial vaginosis. Okay, so we are going to learn how to identify these when we see the clinical vignette. What points to bacterial vaginosis? What points to trichomoniasis? What points to vaginal candidiasis? Then yes, so the cervicitis, we have Neisseria gonorrhea and then chlamydia, and it turns out that the organisms which cause the cervicitis are the same organisms that would cause PID, because from the cervix now you're moving into the uterus, isn't it? So the Neisseria gonorrhea and then the chlamydia infection would end the lower genital tract infections. In the upper genital tract, we've seen endometritis, we've seen pharyngitis, we've seen euphoritis, tubo-ovarian abscess, pelvic peritonitis, and then if you have a complication in the right upper quadrant, you would have Fitz-Hugh-Curtis syndrome. So this summarizes how we are going to approach the infections in gynecology. Any questions? Now, any questions?
No, Doc.
Akusha, any questions?
No, Doc.
Louisa?
No, Doc.
In the absence of any questions, have a good evening.